So in the last two classes, we have discussed about the, general idea. Do not take this thing as a role model, but this is general idea of the letter. We have to, make the structure of the letter as per the requirement or as per the priority of the information. But for your general understanding, you can see there, I just have written something for you. For your basic understanding, this is something, not an ideal structure, as I mentioned earlier. But if you can see there, we have a general understanding. First of all, is the introduction to the letter. Like normally speaking, we have 25 words in the introduction. Normally, it's again a generic overview for those candidates who have no idea about the OET writing, for them to have a basic understanding of the structure. You must be flexible in organization of the letter, in the structure of the letter. What I mean by that, like where to write which thing and how would you sequence the information, it's purely, like case dependent. But as if you are approaching this letter for first time, so give you a general insight, let's say the introduction, we must have a clear reason of writing. First of all, let's say if we have a main complaint or the main concern in simple word, that should be mentioned in the introduction. Afterward, depending upon the letter, as I can see that this is highlighted point, the based on relevance, and second paragraph note will be in the medicine discharge, but that time in the nursing discharge, we have social plus past medical history, but less likely that we can have this social plus past medical history even in the nursing discharge as a second paragraph after introduction, right? Anyhow, so in case of referral letter, we can write it down social plus past medical family history in the second paragraph if it's a strong factor in making the diagnosis or the management of the case. If it's not strong factor or not relevant point that is supporting your diagnosis or will be helping tool for the management, then we will not be adding that particular social past or family history over here, right? Anyhow, followed by the body paragraph number 2. Normally, in body paragraph number 2, in a conventional referral letter, we can see there that we have to write a summary of the information. Let's say if we have 4 to 5 visits that are like the progression of condition, the same problem. Let's say if the patient is having mild chest pain and he visited you for 3 times with mild chest pain, and today he visited you with severe chest pain. So you can see with reference to today visit, we can just summarize in an overview form. We can just summarize in an overview form, about those 2, 3 visits, however they are. And in case of discharge letter, if we have the ward stay or we have the rehab, we must go for the summary. Let's say in the discharge letter, this is the introduction, and after introduction, we should write it down about your, like say, summary of the information in case of a discharge letter, such as the ward summary or the rehab. After that, we have active issue. In again, I'll repeat it for you. This is only the case when we have a progression of the disease. Then this is the active issue or the today visit. You need to expand it. You need to highlight it, like so that we can mention this thing. However, in case of emergency referral, it's preferred, not you can say permanent thing, but it's a preferred way to start from the active issue. But again, you need to see the case from case to case. You have to see, you need to be flexible with your orientation or the structure of the letter. Anyhow, so in the body paragraph number 3 is the main issue, the main subjective complaint as per the today's or the recent history will be mentioned over here, right? Anyhow, afterward we have conclusion, and in the conclusion part, you can see there we have to write down maybe the summary of the diagnosis, for example, or maybe the polite action of request, let's say, or any ongoing sport in the case of, like the closing statement, sign of statement, we can use in the conclusion part. So this is a general layout for the lecture, for your basic understanding, we need to be flexible with the structure of the letter. I'll repeat this time and again. So let's say, what are the helping tool or the structure to structure the paragraph? In each paragraph, irrespective of either it's your body 1, body 2, or body 3, we have three components that will make an ideal paragraph. The first one is the topic sentence. Now, topic sentence will cover the main idea. Like your idea should be pop up in the first line. Let's say if it's the presenting complaint, it should be mentioned in the very first line, or you have to transform the word into your own language. For example, if they have used the complaint as a verb, we can change it to complaint as a noun. And if they have mentioned tiredness, we can change to lethargy, fatigue, and so on. So your first line will indicate, let's say, initially he presented, let's say, to my clinic with mild chest pain. So the first line will indicate that it is something cardiac related thing. So we have the first line that will summarize the main concern in most of the cases, the main concern. And original word mean it should be your words. So you have to transform those things into your own words. Secondly, we have sporting sentences. In sporting sentences, what I mean by that is followed by your topic sentence, which include the description of the symptoms. Like you will explain the symptoms in detail, what the symptoms are, and you will also highlight, like the trend in the treatment, the significant trend, not necessary to mention each and everything. However, try your level best that you would paraphrase the word from the case note. Do not use the same word that has been mentioned. Try to paraphrase the word. The example has already been given. Then we have the signal word. Now, signal words will bring the clarity in the letter, right? Basically, it will indicate at time the transition phase between two areas, and it will indicate, like the change of something, the consequences of something. As these are a few example, although there are a lot of them, but these are a few example that has been written in front of you. These are the signal words in writing a letter. It is also important for you to have the variety and the range and accuracy of those words to be used in your writing letter. Anyhow, so ideal structure of the paragraph we have discussed. Now let's have a challenge that how to write a body paragraph. How would you transform them? So there are three cases we discuss. Like these are all in the past history. I've written so that you can use the past tense. Let's say patient complaint of abdominal pain, 2 by 52, pain constant, word sitting. So any one of you, just you can. So basically, these are three cases. Let's give it a try. That how can you translate them down? So I've done few example for you. Initially on 1st January, patient complained of mild abdominal pain for 2 days. Right, that's fine. Okay, so let's say initially on 1st January 2019, comma, Mr. James reported 2 week history of mild persistent abdominal pain which aggravated while sitting or bending, for example. So I try to change the word that has been used in the case note. So it's better to change as much word as you can, or at least the form of the word. Then let's say if the first visit from today visit, there is a margin of 2 months. This is just an example. Or if the margin of 2 weeks, we can write down 2 weeks back, right? Rather than using this date time and again, I can change the format of the day. 2 weeks back, 2 days back, 3 days back, whatever. Mr. Mark presented with a complaint of. Now, first I used the reported, then I just changed the synonym, the word complaint. Presented with a complaint of chronic. It was persistent. We can change it to chronic mild abdominal pain. However, it's intensified, aggravated, can be changed if it sits or bends. The third one is in the past perfect tense. These both two are past simple tense. Mr. James had moderate abdominal pain, which was continuous in nature and worsened when he sits or bends. So you can see these are few examples that has been done for your better understanding that how can you translate your case notes into a proper grammatical structure. So you can see that this was the line that has been written in front of you. And these are three examples. So 2 by 52 mean after 2 weeks, like, or maybe 2 weeks, sorry. So this line is from the case notes, and these are three transformation of these line, right? Anyhow, So now we have case 2. Let's say if it's just written in the notes, 4 months, for 4 months, his muscle stiffness did not improve. Or even if it's a 4 by 52, so it will be 4 weeks, right? Anyhow, so this is the transformation that has been done for you. I'll repeat for you. So let's say the first case note, so case number 2, in here on screen, that he noticed blood in stool yesterday. So we can change this into the reported speech. He reported that he had noticed blood in stool yesterday. Now, third one, physio for 4 weeks, there is no improvement. So we can write in this way, he had attended physio session 4 months, his muscle stiffness did not improve. And secondly, we can use the clause of contrast over here. Despite Mr. Alex had physiotherapy for 4 months, his muscle stiffness was not improved. The first one is in the past perfect tense, and second one is in the past simple tense. Anyhow, so there is a case that has been displayed for you. We'll try to summarize them down and we'll try to expand it. Though this is a letter of discharge, for example. And in this letter of discharge, what you will do, let's say there's a lot of information. I will tell you the story. In here, the patient has the successful right knee replacement surgery. And after this successful knee replacement surgery, patient returned to ward, right? There's a lot of details that has been written over here. There are a lot of information. It's your job now to summarize them down. You can see a lot of information. So let's have a quick review on that. Like patient returned to ward following right total knee replacement. So his vital signs, they were normal almost. The patient was improving except this HB therapy. Then there was some list of medication, right? And on 26, we have certain details. The warfarin started. You have given Claxine as well. And then we have repeat pathology. We have some finding for there. On this date, they have done some medicine, dressing has been done. So if you have to just extract the chunk from the paragraph, I would appreciate any one candidate just can summarize this thing in the message so that we can next slide. Now we have the rehab. Any one candidate for the rehab. You can see that after that ward, the patient has completed his ward stay. Now, after that ward, like the patient mobility has improved. So he was shifted to the rehabilitation center. So now I would appreciate if anyone can do quick summary for the rehab as well. Toward the next slide. Now we have finally a discharge plan. So this is the job that we have to expand the discharge plan. This is the part when you have to expand the discharge plan as compared to the previous two slides, where your job is to summarize them down into as much confined information as you can, providing the fact that you should not miss anything important. Here, your job is to expand them. Your job is to use the synonym or paraphrase the statement. So I'd appreciate just few candidates, give it a click so that we can display the next slide. Next slide. You can see that now what are the tools that are being required for transformation. Tool that is being required when you have to either expand or summarize the case. Here you can see that we need to have the variety of tenses. Mostly when summarizing, it should be past simple tense if you are writing for a word or for a past event, or at time we can also use the past perfect tense. We can also see that here we can incorporate these sentences, which include simple, compound, and complex sentences to have the variety. However, in summarizing the case notes while writing a word history, we will prefer to use the compound or complex sentences, right? Anyhow, now conciseness means to club the same information and do not write all the given information. You just have to select which information is relevant and which is not relevant, right? Anyhow, so moving on to the next slide. Now we can see still there are some things that can be helpful for you to select and to modify your task. So let's say while we were having this information in the word, I can replace this line just with the unremarkable. This is not something to be written. Okay. And even the history of the medicine, let's say you can see that there was some transition in the medicine, like some medicine you started and some at time you have stopped, let's say Clexine, and the warfarin was decreased. So we may write either in the discharge plan or maybe in our form. So these are some of the abbreviation. This mean like an increase for the hemoglobin was low. So this sign can replace with therefore or consequently. This mean good or positive finding. This mean removal of. This means subcutaneous. NAD stand for no abnormality detected. And MANE stand for in the morning. Nocte stand for at night. QDS 4 times a day. PRN as required. W home with home. Personal hygiene can be replaced with hygienics. Home care can be replaced with that. Okay. Yeah, it's better to expand. You're right. It's better to expand. So now let's say these are some of the example that has been done for you. Yes, sir. As per your question, like we have few example, although there is a margin of improvement, and like some of you have written better than this, but I'm just giving you a few example. Let's say we can write it down the word stay in this format by adding the range of grammar over a period of 9 days. You can see the course of word stay was of 9 days. So we can write it down over a period of 9 days. His stay in ward was uneventful, except, let's say, blood transfusion due to low HB. So it was a complex sentence followed by and the past simple sentence. Like I have used the complex sentence, and the tense was the past simple. Then you can see that I can also transform the whole para in this way. You can read it. He had an uneventful stay, the past perfect, in what except intravenous therapy due to low HB. Beside that, he had been managed with Clexane and warfarin. However, Clexane was stopped on the 6th day. He had shown improvement in mobility. I am writing in past perfect. Thus, he was referred to rehab. So you can see from this point, like before this, I have used the past perfect because I'm trying to write all the events in the past perfect so that I can give the time difference between ward and rehab. Now we can see from this line, like this is the rehabilitation. The rehabilitation program focus on his mobility. This program include the use of frame or even stick was also used on a trial basis. Gentle exercise improves were also done, which were effective as he was able to take shower with little help. I changed with minimum assistance. He became gradually independent. He was therefore ready for discharge with homeless regarding physio exercises. The third approach for this one can also be done in a very concise and summarized manner. You can see Mr. Mark stay in ward and rehab remain uneventful. He had been transfused with blood due to low HB, and the rehabilitation program, which include pool exercises, frame, and stick of whatever, help the patient to make him gradually dependent in term of mobility. So you have summarized the ward and rehab as per like your requirement. If you can see that you can expand the to discharge plan in such a manner that you need to summarize the ward and rehabilitation detail. So from the point of discharge where we are standing, it's not important or mandatory for you to expand your ward stay or the rehabilitation. The thing that is important is to focus on the discharge plan. Now let's say to have a quick review of the discharge plan, I gave an effort. Let's say at the time of discharge, now this is a time clause, a complex sentence. There was no cardiac issue, and his surgical wound is also exposed, right? He has been discharged with home nursing assistant with primary focus on his hygienics, mind personal hygiene. Now you can see that I expand 2 points. Along with that, he was also provided, or he has been, better to use has been, with this care for his day-to-day task. He already has improved mobility as he needs just a little help while showering. However, he still needs stick or frame while walking as per need basis. He was provided home list for physio exercises. This was extracted from the last line of the rehab, which would also help the patient to speed up his recovery. Now, his discharge medication include, now you can see, I have written the discharge medicine, everything in detail, and he has been discharged back to you in order to repeat his FBE, sorry, not R, FBE and INR in view of her last INR of 3.8 and HB of 112. After your review, his appointment has been fixed with rehab. So this is the fact I have tried for the summary, for the expansion of the discharge plan. If you like to ask any question,